It was a Wednesday like any other Wednesday on 4 South at University Hospital. Until Code Blue, room 224. Code Blue. Off ran the team of nurses, doctors, and respiratory therapists into the room. Compressions were started, and the team began to do everything they could to resuscitate Mrs. Jones. Nurse Tina was not sure what to do, so she ran to the code cart and decided she'd attempt to prepare the medications. But little did anyone know how nervous Tina was, since this was her first code. Not only did Tina struggle with preparing the medications, but she was also unsure of which medication to go to next. Within seconds, Tina began to cry. Has this ever happened to you? This feeling of ever-growing anxiety in the presence of a code blue? Well, no need to fret. Studies have shown that stress and anxiety in a code are both common for staff of all experience levels. Fear of the first code can be simmered with some of the following strategies. Looking back at the situation Nurse Tina was in, it was clear that teamwork was in play, which has been found to be the most important part of managing these high acuity situations. However, there was no team leader identified, and according to the Advanced Cardiac Life Support Guidelines provided by the American Heart Association, the team leader role is necessary in managing code situations. This team leader, which is usually a physician, resident, physician's assistant, or nurse practitioner, ensures the appropriate staff are working in roles like medication administration, usually performed by a critical care nurse, respiratory interventions by a respiratory therapist, compressions, and defibrillation. If a team leader was present for Tina's code, perhaps they could have seen Tina's apprehension and shifted her to another role. Other important roles in a code include documentation and also being the runner, who, as the title states, runs to get anything not readily available during the code. Another important component of a code blue that could have helped Tina is the use of closed-loop communication, where the team leader calls out a medication or intervention to be completed, and the person completing this task repeats it back for confirmation and announces when it has been completed. Other strategies to reduce stress in a code include participating in mock codes to become more familiar with the process and equipment, as well as observing as many codes as possible. Practice may not make perfect, but it sure will make the nurse more comfortable. When Tina finds herself in this situation again, she will hopefully have had time to participate in mock codes and choose a role in the code that is more comfortable for her. Perhaps she will perform compressions. Even though stress and anxiety are not entirely preventable, they are manageable, so when the next time a code blue is called, let's keep calm and grab the code cart.